Good morning, good afternoon, good evening to all participants, wherever you are connecting from. Welcome to this session, part of this year's World Investment Forum of UNCTAD on entrepreneurship in the new health economy, the rise of medtech in Latin America. Let me introduce myself. I am Fulvia Farinelli, Senior Economist and Development Coordination Officer at the UN Office of the Resident Coordinator in Argentina. I have the honor and the pleasure to be the moderator of this session. I understand that a similar event on such an important topic in the context of the pandemic, of course, has already been held on Asia, and another one will follow on Africa on Friday. So in our session, we will try to draw lessons as much as possible, policy recommendations as well, based on the Latin American experience. Before introducing our panelists, let me ask Mr. Jörg Weber, Head of the Investment Policies Branch in the Division of Investment and Enterprise at UNCTAD, to deliver his introductory remarks. Jörg, the floor is yours.
Good, I found the button. So, yes, good afternoon, good morning, good evening at times. Very nice to see you again, Fulvia. A great pleasure to be with you here this afternoon. I'm doing this on behalf of course, Richard Bollwein. That should be noted. So, distinguished panelists, dear Fulvia, again, it's a great pleasure to open this discussion on entrepreneurship in the new health economy, focusing on the Latin American region. So I am asked to provide a little bit of a background and sort of lay the foundations of what you will be discussing. Governments in developing countries have increasingly turned to the private sector and market instruments to enhance the efficiency and quality of healthcare provisions. And the pandemic has accelerated this dynamic. There's an outstanding debate of whether this is really the road we should be going down, but let's look into what the private sector can contribute. In response to the pandemic, new investment incentives to promote telemedicine and e-health applications, as well as incentives for the manufacturing of medical equipment, have also been introduced. Digital technologies are already transforming healthcare from the use of drones to deliver blood products and other medical supplies, to the use of artificial intelligence to give paraplegic patients improved mobility and develop new medicines. We all are familiar with these beautiful stories which pop up when we say the world is indeed a good place and there's hope on the horizon and that not all is doom and gloom. As we will hear from our panel innovators in Latin America, these people are taking advantage of technological advances, and we are really looking forward to hearing that from you. Health tech has become one of the fastest growing tech sectors in the region, with artificial intelligence, telemedicine, and data analytics transforming healthcare from managing healthcare costs to improving patient diagnosis. Unsurprisingly, private capital investment in the startup active in these sectors has also increased. There's lots of money to be made there. It is now evident that digital technologies and other types of innovations will play an increasingly important role in healthcare in the years to come. This radical transformation of healthcare sectors requires the engagement of all stakeholders, and UNCTAD contributed to improve the foundations of the healthcare ecosystem on many, many fronts. For a decade now, we have conducted several technical cooperation projects in the region, in Latin America, in the field of healthcare and in the area of entrepreneurship that directly or indirectly improved and impacted, we hope, the healthcare ecosystem of the region. The flagship medtech training program of UNCTAD, which imagine was launched 30 years ago, so it was launched in Argentina 30 years ago, so that should be known in 1988. The network of medtech centers is very strong in the entire region of Latin America, and UNCTAD has supported the governments, I'm told, of Ecuador, Costa Rica, and El Salvador in the development of their national entrepreneurship strategies. To support the development of local production in health industry and capacity building in public health policy, UNCTAD and the International Center of Trade and Sustainable Development, the ICTSD, have organized a series of seminars and trainings on the interface between intellectual property and public health for the entire region. Today, is the occasion to offer an overview of the interlinkages between these various streams of technical assistance UNCTAD and its partners, the ICTSD and others, have developed in the region, and assess what can be done to further support the innovative entrepreneurs in what's called the new health economy of Latin America. So it's now my pleasure to let Fulvia take over this ball and moderate the panel discussion. I'm sure that it will bring new insights relevant to our technical assistance and intergovernmental work in this area, in the region, and that you will help us improve what we can do for you, for your colleagues, and for the countries of the region, and through that also for other countries around the world. I wish to thank you again, distinguished panelists, for taking the time to share your expertise with us. I leave you in good hands with Fulvia, and I leave you hopefully with the notion that this might be looking as a small part of the World Investment Forum, but it's a very important and future-looking topic that we all will be very much looking into in the years to come. And therefore, we look forward to your presentations, we look forward to your discussion, and we thank you once again to be part of the World Investment Forum. So with that, thank you very much. Over to Fulvia, and good luck.
Thank you very much, Jörg, for your nice introduction, for setting the scene, and also for highlighting the important work that UNCTAD is doing in this area and will be doing in the future. Let me just add to what Jörg said, a few words on the specific context of Latin America, where I'm currently based. The region has accumulated about a fifth of confirmed COVID cases and around 30% of all deaths worldwide, despite having only 8.4% of the world population. Here we see a large worrisome asymmetry. Latin America is in fact characterized by conditions of very high vulnerability in the health sector. The rate of doctors and hospital beds per inhabitant are insufficient. The regional dependence on imports of pharmaceutical products is extremely high. Just consider that 87% of all imports of medical products come from outside of the region. And in addition, there is high level of urban concentration, and in some disadvantaged area, there is lack of access to very basic services. So this has made the region especially vulnerable to the effects of the pandemic, considering also that Latin America is the region that was most affected by a fall in GDP and in employment compared to all other regions in the world, as well as increasing inequality rates, which is a long-standing problem of the region. So to understand how to address these challenges, let us now hear from the experts from the region. The exchange will follow a Davos-style format with the possibility of posting questions in the chat box. Please feel free to do so during the entire session. And at the end, we will have 10-15 minutes for Q&As, and I will do my very best to keep aside some time for that. Allow me now to introduce our eminent panelists. We'll hear from Mr. Marcel Roers, CEO and co-founder of Doctor Online Guatemala. Doctor Online facilitates access to healthcare through an innovative telemedicine platform that allows patients to talk to a medical doctor from wherever they are through a mobile phone. Doctor Online has more than 2 million subscribers and provides its services in several countries in Latin America and Europe. We will hear also from Mr. Rogério Boros, Director of Microsoft Healthcare in Brazil. Rogério leads the healthcare industry program at Microsoft Brazil and also invests in healthcare startups. He has over 20 years of experience working for technology solution leaders worldwide and held positions in Brazil, Argentina, Finland, and Spain. We will then also hear from Mr. Robin Rourke, partner of McKinsey in the US. Robin leads McKinsey's healthcare program in Latin America. He works with hospital systems in the USA and Latin America to develop and implement clinical programs to improve quality of care, improve the efficiency of the delivery of services, and reduce the cost of care. We'll also hear from Mr. Andrés Simón González Silén, Chairman and co-founder of Asistencia Global Insurance. Asistencia Global Insurance is a company dedicated to the provision of health insurance for medical emergencies and immediate medical care in Latin America. It is the first insurance for emergencies and immediate medical care for relatives of those Latin Americans who have migrated from their countries of origin. We will also hear from Emmanuel Hernandez, research analyst at the Association for Private Capital Investment in Latin America. LAVCA is a non-profit organization dedicated to supporting the growth of private capital in Latin America and the Caribbean. Emmanuel works in the research department on data collection and the generation of products and services for LAVCA's private capital community. And we will also hear from our colleague, Mrs. Stefania Bonilla, Economic Affairs Officer at UNCTAD, who will present the results of the survey that UNCTAD conducted with the investment promotion agencies of the region, aimed at identifying what are the subsectors in the health industry that emerged since the start of the pandemic in Latin America. So welcome to all of you, distinguished panelists, and thank you very much for being with us today. Let me now kick off our discussion by asking a broad question to all of you. What healthcare challenges does Latin America face that would require innovative, scalable, and sustainable approaches to health system reforms in the region? Marcel, would you like to start?
Yes, thank you, Fulvia. One of the main challenges of the healthcare system as a whole, or what we are seeing, is the lack of access to primary healthcare. And that's where we work. So the lack of access to primary healthcare. Hello?
Yes, we can hear you very well.
Oh, okay. I thought I lost you. So the lack of access to primary healthcare is one of the things that are needed the most in most Latin countries. There are a lot of people who are outside of the coverage by either governments or by insurance or by the private sector. So I think that that's the most important issue to consider. You know, people have no access, and we are trying to solve that by the use of technology to get through them, to use the infrastructure that's already existent, such as cell phones, to really expand access and healthcare to most people. So
Thank you. Yeah, thank you, Marcel. Very clear. Lack of access to primary healthcare is indeed also at the root causes of such an impact, dramatic impact of the pandemic. Robin, is there anything you would like to add on this?
Sure, Fulvia. I think we're at a really interesting and unique time in healthcare, you know, especially in Latin America right now, given the pandemic and all of the changes that we've seen in the attitudes and behaviors of physicians and patients and communities towards healthcare. I think we also are in an interesting time because the capabilities that we have in digital are far outstripping in many cases the capabilities in the way that digital technologies are used in healthcare. And so I think we're at an interesting point because we fundamentally need a more efficient and a healthcare system with greater scale to meet the demands of the population. I think, as you mentioned, a population that is aging, that is growing, and where we're only going to see more disease and need for prevention. And so I think this opportunity to think about how care models can be redesigned, how we can incentivize efficient and effective design, and how we can then get to a scale where systems are able to provide greater access for people in remote regions, more frequent access to prevent disease. You know, this is an exciting moment, but I think it's a big moment to take advantage of, and so therefore the collaboration. I think one of the things we'll talk about today is the collaboration across provider systems and providers, across innovative startup companies with new technologies, and then with the investors and funders to make all of these things possible. I think it is an important collaboration, and the need for partnership is great in the region right now.
Thank you, Robin. Actually, indeed, you highlight this unique time where we have the concrete possibility of seeing care models being redesigned, though opening up new challenges, no? And I hope that after the first round, we can hear more from both Marcel and yourself on how technologies can be leveraged to enhance digital and sanitary inclusion. Rogerio, let me turn to you. What's your take on this?
Thanks, Fulvia. I agree with Marcel when he was saying about the primary access. And if we look into Latin America as a whole, we're talking about 650 million inhabitants, and around 69% have only access to public service, public health. Then we get around 15% that have access to both private and public, around 11% that have access exclusively, not exclusively, but use private health, that they may pay for it. And around 8%, so we're talking about over 50 million people, have no access to health. So there's a huge opportunity for us to transform the region. And that is quite similar on most of the countries, except for Colombia, which has a big private access. Most of the countries are in average similar to what the overall number in Latin America. So I think that's one of the things that we need to look into to understand what is the current offering. I believe that second challenge that I would relate to is, if we want to get the opportunity of startups coming to the market and transforming the business in healthcare, a huge importance that we will have is regarding regulation and regarding data access, because most of the innovation coming in the healthcare sector depends a lot on the possibility that you have data access. So open health standards will be crucial if we are looking into the continuous growth that we have as opportunities in the region.
Thank you, Rogerio. You're adding this very interesting aspect, and indeed crucial for making things happen and making them happen right. So maybe before we close, please keep in mind you owe us a concrete recommendation on how to address this issue of regulation and data access in concrete. Let me now turn to Andres. Andres, what is your view on this? What else you might want to add to this picture of the challenges, and already a bit of the potential solutions? You're muted, Andres.
The most common phrase of the pandemic, right? Of the
Absolutely.
pandemic. Thank you very much.
It has to happen at least once.
Yes. Well, thank you very much first. And I will second what all my fellow panelists have been saying about inclusion, about how data must be treated, and how one of the highest challenges we have is a high degree of information and data that is fragmented and distributed across multiple disintegrated silos. But I would add, apart from inclusion and this interoperability of data, two aspects that I think are very important. One is the private-public cooperation, which leads me to the sustainable aspect, how we see not only this development and innovation in healthcare technologies and healthcare services, which are in the end made for improving the quality of life of our populations, so that we need to take this approach of seeing how the intergenerational sustainability and well-being it's going to happen, and that has to do a lot with financing. And I've seen, many in Latin America, many countries, for example, the great innovator of a region, Chile, for example, or Argentina, which are making very good progress in this matter. We have a lot of startups and we have a lot of good ideas. Thing is, how can we implement them in a sustainable way?
Yeah, indeed. Thanks
for that, we need, governments and private working alongside.
Indeed, you're raising the important issues of sustainability, and so we pass the floor immediately to Emmanuel to hear about his perspective on the financial side of the story.
Yeah, thank you, Fulvia. And also, I think what Andres was saying about the startups is a good segue into some of what we've seen at LAVCA. Because at LAVCA, we are a membership organization for investors in the region. And as such, we are in constant contact with investors, but we also do a series of surveys throughout the year to really understand what's going on in terms of investment activity. So one survey that we did actually earlier this year was a survey for health tech startups. So we surveyed 36 different startups to try to understand a little better what kind of issues they're solving, but also how they were being affected by the pandemic. And I think a good way to also understand the issues, the pain points that they're solving is really understanding the services that they're offering. So we see these startups as falling generally in two categories. I mean, we have some direct to consumer startups, which I think fall more so into what we're discussing here in terms of access, because these are startups that are actually providing care. These are startups like Amparo Saúde in Brazil, which have telemedicine services. They have a network of clinics that can complement those telemedicine services and do diagnostics. And these are startups that are tackling access from many different points of view. I mean, they're tackling access understood as price, because like we've said, Latin America is a very unequal region, so not everyone has access to the same quality of care. Also in terms of location, because not everyone has access to a specialist if, for example, they are located in a very remote area or just a small city that doesn't have as many care providers. But I think it's also interesting to see it from a perspective, let's say, for example, in mental health, in terms of stigma. Because, for example, access sometimes can be related to not, specifically mental health, not like being able, not being willing to see a healthcare provider. So there are startups like, for example, Yana in Mexico, which is an app that uses cognitive behavioral therapy and has an automated chatbot that helps people to access mental health services. And then the other bucket that we see like startups falling into is the business to business side. Which I think is important because these are startups that are providing enterprise software solutions for healthcare providers and to try to make processes more efficient, more transparent. So these are startups that are actually providing solutions for physicians to be able to offer telemedicine services that they can also use to schedule appointments, do monitoring of patients. Because I think that's lacking in the region. That's also a challenge, and having all that software that's available to physicians to provide that a more patient-centric care. It's also really important.
Thanks, Emmanuel. Indeed, we've made already the transition from the challenges to the emerging trends and potential solutions, which is great. Let me turn to you now, Stefania. Can you tell us some detail about what emerges from the survey that UNCTAD has been carrying out in collaboration with the IPAs and what, from their perspective, they see coming up?
Yeah, thank you, Fulvia. It's a pleasure to be here and participate and hear from the other panelists about the landscape in Latin America. Here at UNCTAD, we're working a lot on investment in the health sector. And when you're talking about challenges, I think despite the fact that there's so many needs in the health sector and there's increasing demand, obviously because of the pandemic, we've actually seen from our research that investments in SDG 3, which is the Sustainable Development Goal that deals with health and well-being, has gone down, particularly in developing countries. So this is a major challenge, especially as we see countries, they are having economic recovery plans where they want to reform their health systems, they're focusing on resilience, they want to strengthen their health systems, but there's less investment coming in. And one of the key determinants of attracting investment into countries in the health sector, especially if we're talking about medtech sectors or high tech sectors, is on the one hand, the digital infrastructure of the countries. And on the other hand, the access to talent, right? So the skills in the country, an educated workforce that is able to reap the benefits of technology to be able to come up with enterprises that address these challenges. I really like the fact that data was highlighted by several of the panelists, because I think given that governments have limited resources and there's this competition or increased competition for investment, the more data we have, the more targeted policies we can have. And we know that we're focusing our resources and government resources in the right areas. So I think that's a really crucial point. Here at UNCTAD, I'm working on specifically with investment promotion agencies, including investment promotion agencies in Latin America. And they've played a pretty important role during the pandemic because they're in contact with the private sector. And what they've been focusing on as a reaction to the pandemic is really, usually they try to promote new investments, but as an urgency measure, as a response to the pandemic, they were very much focused on helping existing investors and retaining investments and preventing investors from going bankrupt. So that was their focus. And what they did is also they helped existing investors transform that weren't necessarily in the health sector. Manufacturing of textiles, for example, all of a sudden became manufacturing of masks, or others became manufacturing of hand sanitizers or medical devices or other products in support of the pandemic. So they've been key facilitators between the government and the private sector. So it was really interesting to conduct the survey of what their activities were with regards to the health sector. What we're seeing now is that increasingly in line with government priorities that are increasingly focused on the health sector and want to attract more investments into the health sector, they are now very much focused on promoting new investment in the health sector, which is new for some countries. It wasn't necessarily a priority sector for them before the pandemic, but it definitely is now. When we conducted the survey, which was already in April of this year, around 40% of the investment promotion agencies in Latin America identified this sector as a priority sector. And actually recently, it's been definitely a main topic of our World Investment Forum, investment in health. And to cite some of the best practices or interesting cases that we saw from Latin America, we just awarded Costa Rica, the investment promotion agency from Costa Rica, one of the 3 awards that were given to investment promotion agencies in excellence in promoting investments in health. And they were one of the winners because they've invested so much in the facilitation of this ecosystem that is so important to attract investment in the health sector. So in talent, they've also used special economic zones, so different types of incentives, not just fiscal incentives, but the facilitation of these linkages between academia, between talent. But there are other interesting examples from the region. And I think some of the emerging subsectors that we're looking are increasingly being focused on by countries in Latin America. We see manufacturing of medical devices and manufacturing in general. We see research and development, and we also see medical tourism increasingly in some countries. And pharmaceuticals, of course. I forgot that was a good one, which was already before, but I think even now, I think there's more countries trying to become hubs of pharmaceuticals in the region. I think that's it for now.
Yeah, Stephanie, that's great. And also thank you for highlighting the case of Costa Rica. We are very proud in the region of that country case, also because it's one of the very few countries together with Mexico, which managed to really take advantage the reshaping of global value chains in the pharmaceutical sector, which other countries have had more problems in grasping. So it's great to talk about it. As Marcel, as you spoke about the lack of primary care, let me ask you, based on your experience, how can telemedicine, which is your core area of work, may help to overcome the historical weaknesses of the health systems, and as well as structural inequalities, inclusion, those problems that have made it difficult to control the pandemic in the region?
Yes, it's a great question. So what happens in a lot of Latin countries, is especially in rural areas, is when people have to go to a doctor, they need, for instance, to travel, right? You need to take the bus or even walk in some cases, and that might be an hour, 2 hours, and you need to pay a few dollars just to get there. Then you get to, you know, a private practice, right? And you need to pay for the doctor and wait. Or even if you go to, you know, to a government clinic, then you need to wait even more, pay the medicines, and then take the bus back. This is the reality. And it's not just the money that costs you, but also the time, right? A lot of people lose one day of work. And when you add all of this cost, it gets to be really high. So that's why a lot of people lacks access of this. And so what telemedicine is doing is, or what we are focused on doing is really to everyone basically in Latin America has a cell phone, right? And even the percentage of smartphones have grown, right? So basically everywhere you can, you know, everyone has a cell phone, a smartphone, and they can have data, even if they don't have like a big paid plan, but they can buy data for the day. And with that, they can get access to a doctor easily, right? So that's one of the main ways telemedicine is breaking those barriers, right? Because the technology is there, right? This is not like super high-tech technology. It's just about creating those business models, right? And executing them, and being able to get to the last mile, which is the most difficult part. And this is one of the most difficult challenges that you find, right? How do you build the people, right? How do you get to those people? And for that, you need investors' money, you need private partnerships. A lot of the time, you also need, you know, partnerships with the government to really get to the bottom of the pyramid and solve those challenges. But basically, telemedicine breaks those barriers and really allows for bigger access to primary healthcare. And I say primary healthcare, and that's where we're mainly focused, because that's when you see health as a whole, that's the #1 issue you need to tackle, even before specialists, right? You need more primary healthcare. So that's how you tackle it, right? For instance, in our platform, we not only offer, you know, the standard video call, but we also do chat because it consumes less data. Or if you're in an area where, you know, the signal is not as strong, you need to be able to chat so as not to get cut off in the middle of the call. But all of that technology is available, and it's just about execution, you know. And we need you know, the sector needs money from investment to really be able to get there.
Thank you, Marcel. Let me ask you a follow-up question on an aspect that I think is really important, and I know you're active on that. What is the role of professional and community healthcare education, and what can be done to promote it further?
Can you repeat the question?
The role of professional and community healthcare education, the one that I understand you're pursuing with your NGO.
I'm just trying to understand the question. The importance of the education part of the process
at community level. Yes.
At community. Yeah, it's It's very important because when you really try to penetrate, like, the base of the pyramid, the communities, you really have to do like a lot of work locally. It's not just, about paying for ads on Facebook or on Google. You really have to go there, educate the people, build confidence, show them that you're trustworthy, and that's where they really start trusting you. But there's a lot of work on going one-to-one. It's not just, at least our experience has not, been like, you can be a technology company, but you're trying to execute at a local level. You have to do a lot of groundwork, right? And part of that is education, having people trust technology, having people trust that the doctor that will answer on a phone is a trustworthy doctor, is a doctor that went to school, he's a professional, and all of that.
Yeah, thank you, Marcel. Thank you for this point, which I think really important. Even if sometimes technological solutions seem so easy and so accessible, this does not mean that we don't have to accompany them with the right approach at the grassroots level. Andres, to go back to what you were saying, can you tell us about your experience of what can we learn from healthcare entrepreneurs and their approaches in tackling big challenges such as the COVID pandemic?
Okay, so I just want to point out that I'm a physician. Actually, I'm based in Venezuela. I work all around the region, but I'm exactly in Venezuela, where you would think that how can you possibly develop innovation and technology at the same time? But being a doctor in Venezuela and having had the chance to be part of the broader table of the world through the World Economic Forum and the organisms like United Nations, has led me to understand that when we tackle big challenges like healthcare in the pandemic in Latin America, there are some key aspects that need to be aligned. For example, preparation, what we've done, what we've projected for the future in terms of how to not only see the problem as one stakeholder problem or one aspect, but in terms of systems. And to talk about that, systems, and not the complicated situation we have, but the complex situation. And the complex is better than complicated, because the complex that leads us to understand the multifactorial aspect of these challenges. And for example, taking into account primary healthcare, like Dr. Rogers was saying, and telemedicine and technology, we see that the way to address this primary solution, let's say, going forward to the future, is actually by looking in the past. And if you might not remember, I certainly don't, but our ancestors, our grandparents did have doctors that go in the past, just a few, 80, 100 years ago, was about the patient, about the human being. So doctors would go to where the patients were. I think healthcare has taken another direction towards, build it and they will come, that patients need to go to the clinic. So that takes us into a whole other perspective, taking into account incentives and how behavioral sciences work on human beings at the rural and the urban area. So by saying this, our approach to this huge healthcare challenge we have has been going into the past. So we use telemedicine as the means of taking all the calls from our patients through SMS, through telephone, through chat, and video consults, definitely. But then after that, we try to not solve everything through telemedicine. We try to, and in our experience, we take in our more than 2 million users at the moment in Venezuela, and working around in Mexico, Dominican Republic, and our country, is that we solve almost 30% of the consultations through telemedicine, but then we send doctors to where people are. So by taking into account the whole system that has a part in telemedicine, but also progresses in a continuous way, in a progressive leveling of interactions that make healthcare sustainable, that make it accessible, and make it, let's say, in the population view, massive. So we've taken, the approach of not one-to-one, but millions to millions to take care of them. And, this has to do with the setup of the technology, with the setup of the human resources, and with setup of the logistical side of healthcare. So, in the end, what I'm trying to say is that we can also, to think about the whole system and how to prevent unnecessary visits to clinics and to, higher level and more costly services. We need to take into account this, way of maybe going back and not only using the technology of zeros and ones in code, but the technology of logistics, the technology of human care.
Yeah, thank you, Andres. That's indeed a very important point. Bring in the systemic dimension, all what we are discussing. In this respect, Rogerio, what do you think is the state of readiness of the health system in Latin America for these changes and transformation and systemic thinking and the introduction of advanced innovation in health in that broader context?
Thanks. Well, I believe we are passing right now through a similar transition that the financial industry has passed through. There was a lot of innovation with fintechs happening, and there was this opportunity that we see into open banking. I believe that we are going to get more and more into the same situation with open health. Looking into what are into the state of readiness, what I see is a lot of investments coming from specifically private sector into the big private hospital groups, the exam groups, and health insurance groups. They're investing on startups, creating incubators. If I take Brazil, for example, and Emmanuel was mentioning about a few startups here and in the region, but if we look into the last few years, there's a health tech report from Distrito Consulting, and they were showing that there's investments up to $430 million coming since 2014, and we are reaching up to around 700 health techs in Brazil only, with a lot of growth through last years. Most of them are focusing on sectors which, coming back to my first comment, Fulvia, are really related to regulation. So many of them are related to electronic health records. They're looking into telemedicine as well. Both aspects need regulation. They were especially telemedicine has been kind of released during pandemics, but if we look into how it's established today, there's discussion on Brazilian Congress, for example, the first appointment has to be mandatorily in presence. I would ask Marcel if it makes sense, which makes no sense, especially if we look into the population. He was mentioning there in Amazon, for example, they're taking not only bus, but they're taking boats to go into a place where they can have a medical appointment. So it makes no sense, especially as he was mentioning that internet, mobile internet, at least penetration has grown significantly on all the region. So looking into these aspects, what I think one of the issues in readiness is that we need to have regulation that opens data access, because if we don't have open data access, then we are going to have a lot of innovation coming from the big groups only. In that sense, I have something to say that I think was very positive that happened now in the end of July. Brazil has issued a new policy for a national healthcare data network, where all public and private companies will have to connect to this and to exchange through medical standards, fast health interoperability response standards. They have to exchange data related to electronic medical records. At this point, Brazil is already exchanging all data regarding COVID exams and COVID vaccination. I think that if we roll out to the whole region, could be a great achievement in order to allow a lot of new startups to come and innovate in diagnostics and innovate into procedures, innovate in several different things. And one of the issues is really that we accelerate this data, this health data access, of course, with all security and privacy, which is a big problem because privacy in health sector is more significant than even in financial sector.
Thank you, Rosario. Actually, this was my follow-up question to you because I thought that your point is so important, but we cannot ignore that it goes along with the issue of privacy and security. Do you have any specific view on that? So especially as you were referring to a regional projection of what the market that could be opened up, so important for the region and for also being independent. But in terms of security and privacy, in order for the private sector and market instruments to enhance the efficiency and quality of healthcare provision, what should happen?
No, well, I think first we have to look into the whole opportunity into this segment. If we look into expenditure in healthcare in Latin, it is I would estimate around $250 million per year billion dollars, sorry. $1 million would be very low. $1 billion expenditure. And if we look into taking a part of it that's related to IT sector, so information technology applications into this, it's in average around between 3 and 5%. It depends on the country. There are countries that are spending a little bit more. So we're talking about maybe $5 billion a year just in expenditure for this segment. This is a huge opportunity, and that means that there's a lot of data related to this. Of course, there are hardware as well, but as we evolve into Internet of Medical Things, we evolve specifically into genomics, where is a segment where we have, for example, startups going into genomics in Latin America. We have one in Brazil, VAR Station, that is working on genomics, for example. If we look into this opportunity, we're talking about maybe around for Latin America as a whole into 2014, we're talking about maybe $600 million in terms of opportunities in data, and that's huge. So in order to tackle this and to allow a lot of startups to come and create and innovate, we will have to establish not only a regulation, but a regulation that allows how you do the data interoperability, which is the big problem today, even for existent hospitals. And how do we tackle data interoperability, and how do we implement and privacy, Fulvia, going back to your question, in order to allow innovation without any kind of segregation or any kind of risk to the patients that are sharing their data in order to allow new diagnostics. So that will depend a lot on how we regulate. And of course, security is a big aspect. All over the world, we are seeing a raise in terms of attacks. So existing customers, both public and private, they have to protect their networks. They have huge risks with radiology information, electronic medical records, and everything else. So security and privacy will be essential on all this discussion when we go into regulating how the data interoperability will exist.
Thank you, Rogerio. Before I turn to Emmanuel, Robin, and Stefania to dig a bit more on the financial aspects, that you were also highlighting, Rogerio, as a parallel to what's happening in the health industry, as a parallel to what happened in the financial industry. Is there anything dear panelists would like to add on this specific aspect on privacy and security to what Rogerio said? Robin?
Fulvia, I would just add that I think the need for obviously privacy and security, but also just a better IT infrastructure and ability to track health outcomes in the region is enormous. When you look at a place like Brazil, which I'm sure Rogerio is very familiar with, it represents one of the largest cancer burdens or oncology markets in the world, and I think the fastest growing over the next 20 years, if forecasts prove correct. And so the need to be able to understand treatment and outcomes of, for example, the cancer population, the need to be able to create end-to-end patient journeys and to track patients and consumers as they go through the healthcare system and to optimize the care that they receive, whether it's site of care, type of care, frequency of care, or access to care, it's just an enormous opportunity to both improve health outcomes, but also to reduce cost and improve the efficiency of the system. And so I think it's a critical topic. I think there have been major advancements made, but again, if you think about the way that the healthcare delivery system is changing in the region, it's becoming more digital, it's becoming more accessible. I think this imperative to shore up and advance the IT infrastructure behind healthcare, whether that's through electronic medical records, better privacy and security. I think those are all ways that we can kind of enable a much faster improvement over time in the region.
Thank you, Robin. Let me stay with you then. Regarding the financial aspects, what are the key constraints that are preventing large-scale investment in very fast development technologies in healthcare?
Yeah, Fulvia, I think it's an interesting question. And I think various panelists have already touched on a number of the factors. So I'll try to summarize a few of my thoughts. I think the first, and I believe Stefania mentioned this, is the need to be able to link talent with care delivery platforms, with sources of funding, whether that's private investment, public investment, to accelerate the development of health technology in the region. And I think that can come in a lot of different forms. It can be health hubs, it can be incubation centers and programs. It can be various incentives for, as I think Andres mentioned, public and private partnerships. But I think the need to be able to link the delivery platforms, the payers or insurance and the reimbursement model with the newer technology entrants and kind of innovators in the region is critical. And I would actually argue the innovators from outside of the region as well. So to the extent that you can create landing zones for international investment in health technology in Latin America is a real opportunity. I think the second thing that I would say is there's, in many ways, there is currently a mismatch in, as Stefania mentioned from her survey, the interest in investing. We're seeing a very a growth in the interest of different organizations to invest in healthcare and health technology in Latin America. But I think the interest is at a pretty significant scale. People want to make big investments in health technology, but there are in some ways challenges in finding big opportunities to invest. And so I would encourage anybody in the region that's innovating and trying to improve healthcare to think big. Instead of thinking about 5 or 10 or 20 clinics, what would it look like to be 200 clinics at scale across several geographies? Because those big investments, the opportunity is there, and I think there are organizations that are looking to invest at scale in successful models in the region. The last thing that I would just say is I think it's a rapidly evolving landscape, and I think that poses challenges, but it also poses opportunities. We're seeing a number of innovators and entrepreneurs in the region that are quite successful because there's an opportunity to link financial outcomes with health outcomes, with improved access and service to whether it's a community or a country or a geography. There's a real opportunity because of just this gap, I would say, between where healthcare is today and the digital and health capabilities that exist or that could be accessed. And so I think it's an exciting time. There are many organizations that we're seeing that are making significant leaps forward, not just in core primary care delivery, but also in things like digital pharmacy, in thinking about how to automate health systems and to truly take out cost, and new care delivery systems that really span everything from care prevention all the way to care treatment and acute care management. And so I think it's an exciting time. There are some real challenges, but I think an exciting time for the region.
Thank you, Robin. We have the luxury of having Emmanuel here and LAVCA to give us an insider perspective of how do you see the need of the region, the transformation that's happening in the financial sector to address those needs, and what's the situation?
Yeah, so like I think for this question, it would be interesting to first learn a little bit about the context of what's happening broadly in the region in terms of investment, specifically in venture capital and technology across all sectors. I mean, in the last few years, venture capital has seen an explosive growth in the region. I mean, if you look at our statistics between 2013 and 2016, VC only accounted for roughly 500 million that was invested in the region. And this was across all sectors, not just health tech, but like fintech, prop tech, all of them. VC was a very nascent investment strategy and only accounted for roughly 5% of total capital invested when you compared it to private equity, infrastructure, private credit, and in general, just any other asset classes that were deploying capital in the region. But then around 2017, this began to change. I mean, the ecosystem in general started to see a lot more investment flowing in the region. It essentially doubled year over year. So it reached 1.1 billion in 2017, 2 billion in 2018, 4.9 billion in 2019, and then the pandemic happened. So then during the first half of 2020, a lot of the investors were on hold. They were trying to figure out what was happening and really, just trying to get a sense of how things were going to develop. But then what's interesting is that in the second half of the year of 2020, investment really started to pick up in startups again. It ended up reaching 4.1 billion in 2020, which was really close to the previous record that we had in 2019. Because we started seeing that during the pandemic, a lot of startups with these truly digital offerings saw a lot of growth. They saw increased demand for their services. And then investors saw an opportunity there to put capital to work and support the growth of these startups, but also support this accelerating digitalization trends. And this growth has actually continued through 2021. I mean, we still have a couple more months to go in the year, but I'm happy to share that VC, so venture capital investment in the region, has already reached an all-time record in the region. Through the third quarter of the year, startups in Latin America received roughly 11.5 billion, which is actually more than total VC investment in the last 3 years combined. And this is just in 9 months. But then part of the statistics that we produce as well is that we look at where that investment is going. I mean, we look at very specific sectors and try to understand where investors are putting their capital to work. And we see actually that most of the investment, like Rogerio was mentioning earlier, is going towards fintech. So that's all those innovations into financial services. Then second comes e-commerce. And then we have what we call prop tech, which is real estate services. So in 2021, through Q3, fintech attracted 38% of all investment. E-commerce attracted 26%. And prop tech attracted 11.5%. So health tech, on the other hand, received 146 million in investment, which is roughly 1.3% of the total. So I know that that sounds small, but I think what I want to also highlight here is that this is comparable to what we see being invested in other sectors like education, so edtech, which is educational services, agricultural technology, which we call agtech. And I think this is a sign that there is a lot of room still for growth in this space, because even though health tech might be a relatively small vertical when you compare it to the giants of fintech, e-commerce, or prop tech, I mean, I do want to know that it has been consistently growing year over year. In 2019, it was only 53 million across 23 transactions. In 2020, that number doubled to 117 million. And then in the 9 years that we have so far in the 9 months, sorry, that we have for this year, health techs have already raised 146 million in 29 transactions. So yes, I mean, it's a small part of the pie, but it's a part of the pie that's increasing year over year, and especially I think last year and this year with COVID and a lot of the vulnerabilities that have been exposed in the healthcare sectors, there have been a lot of startups that are coming in and finding solutions to address these problems, and investors are seeing that as possible opportunities to to invest and support these startups, but also to solve some of the issues that we're seeing in the region. Thank you. You're muted, Sylvia.
Sorry. Thank you. Very interesting, Emmanuel. Stefania, on how could you complement what Emmanuel said in terms of the perspective, the very specific perspective of the IPA and what emerged from the survey in terms of unfulfilled needs and emerging trends?
Yeah, thank you. I think in terms of access to finance and investment, I completely agree with what Robin said, that there seems to be a bit of an asymmetry of information between investors, and there's a need, and I think the government has a role in facilitating this, of facilitating access to information about bankable projects that exist in the region. And while it's true that perhaps very big investors need, very, very big scalable projects, I think there's to be able to facilitate and make this finance flow also to these poorer regions or smaller scale projects, or perhaps projects that have a risk profit ratio that's a bit less attractive to these big investors. I think it's important that the government works together and that we target these sort of blended finance partnerships types of finance, with including development banks, including international organizations, together with venture capital and together with foreign direct investments. And I think that's what we're seeing also, that these sectors that are related to the Sustainable Development Goals, including SDG 3 on health, there are particular sectors, and making finance flow towards them will require a blended approach and will require public and private working together to be able to make this finance flow also to these more vulnerable regions. And what we're seeing across the world, as well as in Latin America, is that there's two tendencies. On the one hand, governments and countries are facilitating, so opening access to the sector in terms of offering more fiscal incentives. Perhaps some countries also before had sectors that were closed to foreign investments, in hospitals and the insurance sectors, that they are now opening. But on the other hand, we also see protectionist tendencies, right? And competition in the pandemic. So it's these competing interests, I think, that's interesting. But yeah.
Yeah, indeed. Thank you, Stefania. It's clear that we do need to promote the convergence of public and private sector, as you said, government, business, academic actors, to develop an efficient healthcare service sector and in possibly a competitive pharmaceutical industry, shoring up a large-scale regional market, as most of you have highlighted, and promoting regional value chains to compensate the current asymmetries among and within countries. I would like to ask you to provide one key recommendation on what you think that are the enablers, what could be the incentives how can we foster innovation and startups in the health sector? Where are the main opportunities, and especially what are the enablers that could make them happen? Who would like to start? Yes, please, Andres, go ahead.
Yes. Okay. So in terms of enabling innovation and startups and, new ideas and action, because apart from ideas, taking action and actually developing them and making them scalable is what we really need in our region to make profit of, all these good things that we've been hearing, that, the investment is doubling, and we need to be able to not only take part, but also do the best we can with that. So I think one key aspect is to make our politicians and our governments understand the importance there is into making, enabling and fostering entrepreneurship. And that means making it easier for entrepreneurs to not only develop these ideas, but from the very simple structural things like making their companies and having access to small credits and financing so that they can advance. Also, another part that has to do a lot with government as well is to open spaces for innovation. For take into example my sector, which is not only healthcare but also insurtech, that has to do with fintech and how to innovate in the insurance business, in the insurance models, how to innovate in the financial models. Those are models that are so conservative and they actually work well, and there needs to be full regulatory, observation, but there also needs to be, like a sandbox, a space where we can see best practices. And that's, for example, a sandbox is a good way of, fostering this innovation. So it's not without control, but it's, just understanding that, the way of going to a future and enabling these good solutions is to help to be on the side and not to be, obstructing this innovation.
Thank you, Andres, for being so concrete and practical, and indeed the sandbox. I'm happy that the idea came up because I also agree with you. It can help. It can really help. Rogerio, is there anything you would like to add from your perspective?
Very quickly, I think it was, if we take a perfect comment from Stefania, I think what would really improve the sector is, we're talking about health, talk about lives of people. So we cannot allow any kind of innovation without responsibility and regulators. We have regulators that are looking into the pharmaceuticals and procedures and everything. But in order to innovate in there, I think we have exactly what Stefania was saying. We have to break silos between private and public sector, and we have to have data interoperability. And based on that, and I'm sorry to repeat this point, but I think that is crucial. If we allow data interoperability, being it on radiology, being it on medical exams, being it on electronic medical records or anything, there will be a lot of opportunity for innovation, and definitely there will be investment, because with that, health techs will appear and they will bring innovative models and they will bring investment. But in order to have these basics, we need to get the ability for all of them to have access and think about new things. There are a lot of, as Dr. Andres is here, there are a lot of physicians getting into innovation, but there are engineers, there are people from IT, and there are people from everywhere just looking into procedures in healthcare. So some of them will be able to innovate without regulation, but most of them, in order that we get into very deep things like gene editing, like usage of holography into surgeries, Many things of that need better regulation so that we go beyond telemedicine to telesurgeries, to go to other things that will transform healthcare worldwide.
Indeed, thank you, Rogerio, for reiterating the point, because it's indeed a very important point, and it's good to emphasize it. Marcel, what's your perspective on what needs to be done?
To foster healthcare innovations, there's another important thing that I want to add to what kind of on the point of what Stefania was saying, and it is there's a big difference in terms of investments, even in Latin America, because I've been from Guatemala, a smaller country, right? Getting investment from those smaller countries versus when you are in Mexico, Brazil, Colombia, you kind of get forgotten. I don't know what the statistics are, but we've been funded only by Founders Fund so far. And when we try to go out and raise money, right, kind of the risk ratio is not as attractive because we can't compete with the Mexico side or the Brazilian side, right? So you're competing when you're in a smaller country, you know, it's more difficult to compete. So my particular recommendation is how to solve this problem by maybe, you know, getting matching funds from the government to make it a bit more interesting for the VCs or private investors, because to develop companies, you know, innovation, entrepreneurship, and all of that in whatever sector, there needs to be investment, right? Especially technology is expensive to develop, right? Salaries of developers keep on getting up, right? So you need investment, right? It's very difficult to, you know, to bootstrap a company, right? So there needs to be ways, private partnership with the public sector to get more money to the smaller countries, because right now most money is going to Brazil, Mexico, Colombia. So that would mean because smaller countries are being kind of left out of this investment boom that it's happening.
Thank you, Marcel. Robin, would you like to complement what they said so far?
Yeah, I would, and I'll take it from a slightly different perspective, Fulvia, because I think we've done some recent research in across a number of different Latin American countries, which we're going to publish later this year. But we're effectively looking at the way that providers are responding to the recovery and to the management of the pandemic, and really understanding at a health system level, you know, how different providers are faring. And I think what's interesting is that the early results would suggest that 1/3 of providers are doing much worse than they were before the pandemic. 1/3 of providers are roughly in the same financial and ability to provide care at scale that they were before the pandemic. And 1/3 have actually greatly accelerated in their capabilities and their clinical offerings and the scale of the business and the financial performance of their businesses. And they're actually very healthy and resilient health systems that are sort of in that third category. When you look at that third category, the ones that are doing very well, they are the health systems that are quickly adapting to a new care delivery model, thinking about care delivery as an ecosystem, using both digital and physical assets. And I think as a result, you know, they are thriving in this kind of new normal, if you will. So I think actually the opportunity for the region is actually to find ways to enable and encourage the success of these models, whether that's through reimbursement structures and thinking about how to reimburse on you know, for value versus for activity. Thinking about how to enable the success of these models, whether that's, you know, enabling telehealth and virtual health, at-home healthcare, healthcare in lower cost settings of care. I think those are all things that the successful providers will be deploying over the next few years. And I think, you know, to the extent that the region can enable and encourage those things through reimbursement and other structures is important. And the last I would say is that I think healthcare is ready to become much more international in Latin America, and I think the ability to provide care to populations beyond the border of a country is really interesting. And so thinking about how private enterprises can scale, how the public systems can more effectively collaborate, I think those are all big opportunities and ones that should be both evaluated, investigated, and then encouraged as we think about how to improve the care in the region.
Thank you, Robin. Thank you. Very interesting complementary perspective of what Andres, Marcel, and Rogerio had highlighted as key entry point and key priority for going ahead. Emmanuel, what's your view?
Sure. And so, just going back a little bit to what Marcel was saying about how to attract more investment, which is what's lacking in some countries. And there are a few strategies that governments can take to deploy more capital into venture capital. And one of them is, for example, setting up what's called a fund of funds to support the emergence of local fund managers. So this is basically an investment vehicle in which the government commits a specific amount of money so that that fund that can then invest into investors that will then invest into startups. So an example of this is, for example, a strategy that was adopted in Peru this year. It was launched by COFIDE and the Ministry of Production. So they created an $18 million vehicle that's called a fund of funds that will invest in fund managers that are going to be investing in startups in Peru. So a similar strategy could also be done in other countries to support the emergence of local fund managers, especially in countries, like Marcel was saying, that might not be as attractive for international fund managers yet. Other strategies can also include deploying more capital to development banks. So this is, for example, something that we see in Brazil. There are development banks that can also invest capital into the local fund managers that will then invest in the startups. So for example, in Brazil, this year we saw that the Brazilian Development Bank invested in a fund that will invest into Internet of Things or IoT. So similar strategies could be done in healthcare, in which there is a development bank that commits money into a vehicle that's specific for health techs. The other option, although this requires, I would say, a bigger level of commitment, is what Andres was saying earlier, which is the establishment of local government-backed accelerators, innovation hubs, incubators, venture builders. There's a lot of different models for this. And a good example of this is an institution called Ruta N that's located in Medellin in Colombia. And it basically acts as an acceleration program for really early startups. And this helps to really develop the local ecosystem, especially when some of those founders might not be yet ready for institutional capital. The acceleration programs act like a bridge to help entrepreneurs really develop all their strategies, their business model, and everything, so that they can later turn to international investors. And then just one last recommendation, I would say also, because this is something that we haven't touched yet, corporates can also play a really important role in the investment of, in the, like promotion and enabling of investment into startups. We actually see a lot at LAVCA that there's a lot of new venture capital vehicles that are coming up with corporates as their main backers. So for example, in Brazil, there is actually one that was launched by, it's called the Albert Einstein Hospital. And they committed 100 million reais to the creation of an investment vehicle that will only invest in health techs. So this is an investment vehicle that is going to be managed by a third party. It's an impact investor called Vox Capital. So this is, I think, a model that's interesting, because this is an example of a corporate actually committing a specific amount of money, then delegating the responsibility to a third party to do all the portfolio management, looking for the startups, doing the actual investment. But this is also something that could be replicated across other markets with other corporates.
Thank you, Manuel. You mentioned so many interesting and inspiring examples that could be scaled up, replicated in the region. Stefania, before we go quickly to the Q&A and to the closing, the last word to you to wrap up on key enablers, recommendations, and incentives.
Sure, thank you. I've been quickly taking notes of all the interesting things that everybody has been sharing, so I hope we can keep in touch. Yeah, I don't think there's that much more to add. If anything, I think what has come out from listening to the panelists and from our work is, I think we know that the market cannot do it alone, right? So I think if there's one key takeaway is that policy matters and government has a role, right? In channeling investment and channeling finance towards the health sector. And especially as Marcel highlighted, in channeling finance towards projects and countries that are facing incredibly harsh competition. And so the government has a role in terms of facilitating this investment, in terms of facilitating linkages locally between the entrepreneurship sector, academia, innovators, the education system, but also, and this is a point that Emmanuel highlighted, while health is a priority for governments, it's also a priority for businesses. And I think the government has a role also in facilitating these linkages between many of the multinational companies that do invest in Latin America, facilitating these linkages between them and the local economy and local SMEs so that they can work as suppliers, provide services for them, and foster technology transfer. So yes, my takeaway is that the government, their policy matters, and that they have an important facilitative role in the sector.
Thank you, Stefania. Nice wrap up. I see one question posted in the wall for Andres. We have a few minutes to address it. So Andres, what is the most effective way of thinking about public-private sector partnerships? What, for example, is the role of foundations in mobilizing effectively those partnerships?
Okay. That's something very important, and it has to do, you know, with what I was saying before, trust, and you know, between the stakeholders in the country is very important, and we think it's very important to foster and to promote this public-private cooperation is for us in the private sector, including NGOs, to take the first step, to put in front, you know, what our values are and the need for cooperation. What this means is actually taking action. For example, in Venezuela, March last year, when the pandemic started, we decided to launch a free telemedicine platform, or what we call a public access telemedicine platform, so that everybody could have a medical orientation at any point, completely free, and, you know, a public service through or from the private sector. And that led us to cooperating with local governments and local politicians in terms of, well, we have the capabilities. We want to do good, but we understand the importance, as Rogelio was saying, of doing it in a proper manner, in a regulated manner. So I would say it sounds maybe too romantic, but it's true that we need to put trust into this equation. And trust, the best way is to give trust, and then, you know, we will receive. So we have to take action. We have to promote systems. And, you know, in the end, just remember that we are all in the same boat, that is about bettering the quality of life of our people. And, you know, apart from business, apart from NGOs, we're working on the human scale of this challenge, which is healthcare. And that would be my take.
Thank you, Andres. We have 1 or 2 minutes before the closing to give you the opportunity to raise any point that you would like to raise that didn't emerge during this discussion. Is there anything you would like to add?
I want to add something very quickly.
Please.
It's the discussion, the impact and the opportunities are great, because once we start using technology for the betterment of the health services, think about the possibilities, right? Anyone, anywhere can access a doctor, right? It will integrate with all of the systems. It will get paid by the government or by the insurance company. Your medicines will get delivered to your house, So the opportunities are great for bettering the life of all of the 600 million people in Latin America. So it's a conversation worth having, and especially we need to take action, and not just us, but everyone to get there. So it's an exciting time, and there are a lot of opportunities.
Thank you for highlighting that. And we really hope that through this debate and all your contributions, very valuable contribution, we have contributed to go in that direction. We are now getting towards the end of our session. If there is nothing else that you would like to raise. Yes, Andres, I see.
Yeah, I'm sorry. I just wanted
Please.
I've been fascinated by this conversation. I just wanted to add something that might be the title of our next panel at some point in the recent and upcoming history. The power of migrants. The millions of migrants we have throughout North America, Europe, and even the Middle East, that can be a very big power of transformation and change in our region. It's something that we need to take into account. And with that, I'm just saying, how globalization is a reality, and we need to take full advantage of it. Thank you very much.
Thank you. Thank you so much for this last pearl of wisdom that you shared with us. We are really now at the end of our session. Let me conclude by saying that in Latin America, we seem to be at the crossroad. On the one hand, it's clear that we need to accelerate public investment in health and increase public spending in health to move towards the 6% that is recommended by the WHO instead of the current 3.8% on average in the region. This is not going to be an easy nor a fast process, we know, given the negative impact of the pandemic, the current budgetary constraints, and the debt burden of the region. On the other hand, a new healthcare system thinking is emerging, according to what you said, where the service-oriented side of healthcare is becoming prominent, and a new role is opening up for startups. If appropriately framed and regulated, as you all highlighted, public-private sector partnerships and entrepreneurial ventures are going to be key in making the healthcare service in Latin America more affordable and more evenly distributed. We should take advantage of the current window of opportunity. Several of you spoke about a unique moment and unique window of opportunity to restructure health systems and move towards universal, supportive, and resilient systems of social protection, including healthcare, which is something that our Secretary General at UN has repeatedly recommended. So thanks to all the panelists for having contributed to this very interesting discussion, and thanks to all the participants for their interest. I'm now closing the session. Bye-bye.
Thank you.
Bye-bye. Thank you.
Bye. Thank you.
Thank you.